Hi, Isabella with Cruise Wedding Planners. I've been asked by my clients about the impact COVID-19 has on cruising industry. Some of my clients believe that COVID-19 has literally sunk cruising and they've taken their last cruise. And some of my clients believe that no, it's going to bounce back. They're going to cruise again. They just wanted to know when to rebook their future cruise credits for and when is it going to be safe to travel again. I believe that cruise lines are doing everything possible in order to basically stay afloat. And I believe also that, yes, they are going to probably go through some downsizing. And I'm going to talk about the downsizing of the cruise industry in my next video. So if you subscribe to my channel and hit that button there, that bell, you're going to get notified when that video is coming out. Now, when it comes to travel itself, it's already changed. It's changing and it's going to be very, very different. So first change that is already implemented is face masks at airports, on planes, trains, terminals, and possibly also cruises. So face masks are here to stay. So ladies, throw out those lipsticks because that part of your face is not going to be seen in public for a little while. It's going to be mandatory. If you don't have a face mask and you want to board a plane, you will be refused boarding, and most likely the same is going to go for cruises. Besides wearing a face mask, the concern number one is that you want to feel safe when you're traveling to somewhere, and you want to know that this place is COVID-free and that country is going to welcome you with open arms because they also want to know that you are COVID-free. So you're not bringing COVID into their country and vice versa. You don't want anyone coming to your country with COVID and reinfecting people. So some kind of a health check is going to be mandatory, whether they're going to be still checking your temperature or asking you questions, having you fill out a questionnaire. Some countries are even talking about implementing what they call a health passport, and Chile is already talking about it and trying to implement it. It's still very controversial. People are still thinking, how is this going to work? But basically, my advice is stay healthy, because it's only healthy people who can prove they're healthy and not COVID carriers that are going to be able to travel anywhere. So that health check or that passport might be another thing that is going to be required for a while until a vaccine is invented for you to travel. So mask, the health check, and they're going to try to avoid crowding and avoid all kinds of lineups. So I think that your checking procedures are all going to be electronic now. So cruise lines already have been doing that, where you had to check in online, scan your passport, scan your photo, put all the information there, so then you don't have to line up too much, and that procedure is much faster now. And plus also you have to probably be compliant when it comes to showing up at the terminal at a specific time, because they're trying to make sure that there is no lineup and everybody gets checked in efficiently. And so you better have a good reason why you showed up on a different time than it was designated, unless you have the excuse of missing a flight or your flight being delayed. You have to show up. When it comes to public areas, it's going to be the same as it is on land, and that means that you're going to be asked to keep the social distance. The restaurants are going to be the same as on land. Tables will be staggered. Menus might be disposable or electronic. Your waiter might be wearing a mask and gloves. So something to get used to. You might be asked to disinfect your hands more often. You might be asked to wash your hands, and then you actually might have staff making sure that this is done. So yes, you might get that bathroom lady attendant still, and what I call hand washing police. So that's going to be all over the ship, because they're trying to do. They're trying to make sure that the hygiene and the cleanliness on ship is almost on the same level as it would be in a hospital, because they're going to try to upgrade their disinfectants and even maybe implement those fogging booths where you walk through and you get disinfected, besides just washing your hands and maintaining your cleanliness of the cabins and so forth. They're also try to prevent crowding by not filling up the ships and not going at full capacity, leaving some cabins open so there is space in between, and of course maybe even do away with inside cabins, and making sure that they upgrade their medical facilities where they have isolation possibilities, ICUs, and protective equipment, and a little bit more robust health information, and of course training for their staff. So I think, yes, there's going to be cruising. It's going to be different. And if you have any questions or comments, please leave them below. Give us a thumbs up. And hopefully I will talk to you next week.